Minister, last week we discussed the nursing homes and you reassured me that our citizens in nursing homes were not being treated different to other citizens. I have to say I am since not reassured. I remain unreassured, if that's the right term. According to the latest figures from NEFIT, there have been nearly 600 deaths in nursing homes. And today in the debate I noticed that the Taoiseach was saying that there's obvious difficulties in nursing homes, and sometimes medical directors, maybe not even a GP or a medically qualified person, may be present. And that's in contrast to the reassurance that you gave me last week. So I want to ask you again, who's making the decisions not to move residents to a hospital setting, acutely sick residents? And the question remains about the type of treatment that's available in nursing homes, and is it equal to the type of treatment that's available in a hospital setting? I'm referred in particular to an Irish Times article on Monday which showed that there's a memo from Professor Michael Barry of the HSE on the prescription of an antibiotic called azithromycin. It's hope I get the I'm sure you know the article, but I hope I get the antibiotic term properly pronounced. And he is saying in it that we have to be careful about prescribing this in community settings to ensure the safe use of the agent itself and the continuity of supply. There is a global shortage of this antibiotic. So which is more important, the safe use of the agent or the continuity of supply? And if that agent is administered in hospital settings, why is it not available in nursing homes? Because that seems to me that nobody left behind statement doesn't tally with that fact. My second question to you is on direct provision, which we also discussed last week. And I did say at that time that I believed that this could turn into our next catastrophe after nursing homes. And we all saw on the news last night the terrible scenes from Cahersiveen, where the occupants of Direct Provision Centre were screaming to be taken out of there, that they believed it was highly infected. And they're correct, because when they were moved at Patrick's Weekend from a Dublin setting, there was at least one case in the setting that they previously resided in. Yet I understand they were all moved without having been tested, and now there are multiple cases in Cahersiveen. So in last week's debate you said to me that there'll be 19 response teams across the country led by senior nursing supports to assist the nursing home and long-term residential care facilities. Will you now send such response teams into direct provision centres and also ensure that those who are looking to be moved out of them will be moved out of them? I know it's the responsibility of justice, but it's also the responsibility of health to ensure that they receive the right treatment, and that any clusters in nursing homes receive the same treatment, in direct provision centres receive the same response treatment as you've promised in nursing homes.
Thanks, Deputy Smith. So just firstly in relation to nursing homes, as you know, HICWA have started their visits to nursing homes, both private and public nursing homes. They published a new assessment framework, I think last Tuesday, and they've started those visits. HICWA are the regulator. They have a direct line to me. I meet them at least once or twice a week, and they'll be in a position to highlight any issues of concern that they may have. But I do repeat and stand by the comments I made in this House last week in relation to clinical decisions deciding the care that people get. In relation to the Professor Barry letter that you referenced, I'm going to come back to you on a written response on that, Ciarán, just to ensure my accuracy in relation to it. On the issue of direct provision, I'm glad you raised this because it just gives me a little bit of time to respond to it, but I need to let Deputy Murphy in as well, I think. Are you? Yeah, so just if you could give me just 2 minutes, if that's okay. So since the beginning of the COVID-19 pandemic, the Department of Justice and Equality and the HSE have worked closely together to support the health and welfare of asylum seekers and refugees availing of the State's accommodation services. The Department of the HSE are following the HBSC's COVID-19 guidance for homeless and for vulnerable group settings, including direct provision settings. That guidance is published on the HBSC's website. The guidance exists precisely because it was recognised that congregated settings such as direct provision centres do present specific challenges. Together they've put in place a range of measures in the Department's accommodation centres to address any cases of COVID-19 where they arise. This includes provision of self-isolation facilities and centres and a number of off-site self-isolation centres around the state. date. In all matters related to COVID-19, the Department of Justice is working with the HSE to implement their public health advice. The established procedure across all centres where a person is suspected of having the virus or is confirmed as having the virus is that they're moved to a dedicated off-site self-isolation facility. Supports are available for the duration of their period of isolation until such a time as the HSE considers that they can return to their centre with no risk to other residents or other staff. All residents considered to be especially vulnerable to this virus on age grounds or special medical grounds have been cocooned. The direction from the HSE's National Social Inclusion Office is that non-family members sharing a room in centres are considered to be a household during the COVID crisis and should implement social distancing measures on the same basis because they're already close contacts. Residents have been made aware, as have we all, of the appropriateness of social distancing, good hand hygiene, cough etiquette. Information and posters have been distributed to all centres. Centre managers have been advised to increase the standard and frequency of cleaning throughout the centres, paying particular attention to communal areas. A regular supply of hand sanitisers for centres is in place. The Department of Justice has put in place a national clinical telephone service to provide public health advice to support centre staff, and it's used to advise, support and work with locations where vulnerable groups are present relating to the implementation of the guidelines. And I suppose it is important to say the Department of Justice and the HSE want to protect the identity and medical confidentiality of residents as required by law, but obviously will comment on outbreaks if there's a public health reason to do so. But generally residents of centres are subject to the same current public health measures that we all are in relation to 2 kilometres from your home, and the Department of Justice and the HSE will continue to work together very closely on this for the benefit of residents and centre staff.